Long-term output of the adrenal trial. Definition: adjunctive corticosteroid treatment in critical ill patients with septic shock adrenal trial, which tested the hypothesis that hydrocortisone will result in lower mortality than placebo among patients with septic shock.
Trial is a randomized controlled trial of corticosteroids in septic shock. And on behalf of the management committee of the adrenal trial, the site investigators, the clinical trials group of ANZICS, and the George Institute for Global Health, it's my privilege to report the results of the trial here today. Now, sepsis is a major global health issue, and people realize that, and the mortality rates in people who are hospitalized with severe sepsis and septic shock still approaches somewhere between 30 and 50%, depending on which part of the world you live in. We don't have a proven pharmacological cure for septic shock, apart from antibiotics, fluids, pressors, and supportive intensive care. And so the search for adjunct treatments in septic shock continues, and one such treatment that's been looked at for many, many years is corticosteroids.
Application in medicine. Randomized clinical trials evaluating the efficacy of adjunctive corticosteroids in septic shock have shown conflicting evidence of clinical relevance. Two trials in particular look at lower dose hydrocortisone, 200 milligrams per day, and its effects on mortality in patients with septic shock, resulting in conflicting results in regard to mortality, but both showed early reversal of shock in patients treated with hydrocortisone.
The first reported trial of steroids in sepsis was way back in the 50s, and the first reported trial of steroids in the treatment of septic shock was in 1976, the Schumer's trial. The initial focus was always on high-dose corticosteroids, and as Anna mentioned before, two large trials reported in the New England in the 80s, looking at 30 milligrams per kilo of methylprednisolone, reported an increase in adverse outcomes in the group treated with steroids. Following these two trials, there was a reduction in the enthusiasm for using steroids in these patients till the report in the mid-90s, which said that not high-dose steroids, but if you used a supraphysiological or a low-dose corticosteroids, then there certainly was an improved pressor responsiveness in the patients treated with steroids and a trend towards improved mortality.
The current surveillance sepsis guidelines recommend the use of hydrocortisone in patients with septic shock after adequate fluid resuscitation and use of vasopressor who have not achieved hemodynamic stability.
The analysis of the results was obviously debated. The Anand trial used fludrocortisone, whilst the Corticus didn't. There were differences in the study population between these two trials. The Anand trial was predominantly a medical sepsis cohort, whilst the Corticus was a surgical sepsis. And there were concerns about equipoise issues in the Corticus trial, which is one of the factors which led to the premature cessation of the trial. And the Corticus trial reported an increase in adverse effects with steroids, whilst the Anand trial didn't.
Issue applied in Ecuador. On January 19, 2018, the adrenal trial results were published, trying to, one for all, answer all the questions of the adjunctive steroid in septic shock. However, it is still being discussed, and there is no connotation with Ecuador until now. Statistics and publication, global point of view.
Surprisingly, with the massive information, with conflicting results, there was substantial global uncertainty in the minds of clinicians, and it resulted in marked variability in practice. So it's really against this background of uncertainty and the importance of this question.
Pros and cons of chemotherapy for TBM. Pros: the treatment improved secondary outcomes, including shock reversal, ventilator-free days, LOS in the ICU, fewer blood transfusions required. The trial is an international, pragmatic, double-blind, parallel, randomized controlled trial, increased the validity of the results. Cons: Due to the weak recommendation, there has been a variability in use of corticosteroids in septic shock. No statistical difference in mortality at 28 days, rate of recurrence of shock, number of days alive out of the ICU, number of days alive out of the hospital, recurrence of mechanical ventilation, rate of renal replacement therapy, incidence of new onset bacteria of funginemia.
Patient-centered outcomes. The strengths of a study: this was a pragmatic trial with significant statistical power. We had a central randomization with allocation concealment. We blinded our trial group assignments, which were independently.
Conclusion: among patients with septic shock undergoing mechanical ventilation, a continuous infusion of hydrocortisone did not result in lower 90-day mortality than placebo. In adult patients with septic shock, hydrocortisone did not affect mortality at 6 months after randomization. Concluding considerations.
Did not lead to a significant reduction in mortality at 90 days in patients with